As a project management expert, I understand that a company's benefits package, including health insurance, is a critical component of its overall employee value proposition. It's not just about attracting talent. It's about fostering a healthy, productive, and engaged workforce. Let's delve into what health insurance might be like at Scoro, a company known for its project management software, by applying project management principles to understand its structure, benefits, and overall impact. While specific details about Scoro's health insurance plans might vary and are best obtained directly from the company, we can analyze the topic through a project management lens, considering the key elements that make any employee benefit successful. Defining the project. Scoro's health insurance offering. Think of Scoro's health insurance as a project with several key objectives. Attracting and retaining talent. A competitive health insurance plan is crucial for attracting skilled professionals and reducing employee turnover. Promoting employee well-being. Providing access to quality healthcare contributes to the physical and mental well-being of employees, leading to a healthier and more focused workforce. Increasing productivity. Healthy employees are generally more productive and take fewer sick days, directly impacting project timelines and deliverables. Enhancing employee morale. A good benefits package demonstrates that the company values its employees, boosting morale and fostering a positive work environment. Compliance and risk management. Ensuring the health insurance plan complies with all relevant regulations and mitigates potential health-related risks for the company and its employees. Key project management principles applied to Scoro's health insurance. To understand the effectiveness and structure of health insurance at Scoro, we can apply several core project management principles. 1. Clear goals and objectives. Just like any successful project, Scoro's health insurance should have clearly defined goals. These might include providing comprehensive coverage, offering a range of options to suit different needs, ensuring affordability, and delivering excellent service to employees. The objectives should be specific, measurable, achievable, relevant, and time-bound. Smart, although the time-bound aspect might be less direct for an ongoing benefit. 2. Stakeholder management. In this project, the primary stakeholders are Scoro's employees. Understanding their needs and expectations regarding health insurance is paramount. This could involve surveys, feedback mechanisms, and clear communication about the available plans and benefits. Other stakeholders include the HR department, project managers, the finance team, budget, and the insurance providers, external vendors. Effective communication and management of these stakeholders are crucial for the success of the health insurance program. 3. Scope definition and management. The scope of Scoro's health insurance encompasses the specific medical services covered, the network of healthcare providers, the costs involved, premiums, deductibles, co-pays, and any additional benefits like dental or vision care. Clearly defining the scope and managing any changes or additions to the plan is essential to avoid misunderstandings and ensure the program meets its objectives within the allocated budget. 4. Resource allocation. Providing health insurance involves significant financial resources. Scoro needs to allocate an appropriate budget to offer competitive plans. This includes negotiating with insurance providers, managing administrative costs, and potentially contributing to employee premiums. Efficient resource allocation ensures the sustainability and effectiveness of the health insurance program. 5. Communication and transparency. Clear and consistent communication is vital. Employees need to understand the details of their health insurance coverage, how to access care, and who to contact with questions. Scoro's HR department would likely play a key role in providing this information through onboarding materials, internal communication channels, and dedicated support. Transparency builds trust and ensures employees can effectively utilize their benefits. 6. Risk management. Potential risks associated with the health insurance project include rising healthcare costs, changes in regulations, employee dissatisfaction with the plan, and administrative challenges. Scoro would need to have strategies in place to mitigate these risks, such as regularly reviewing the plan, exploring different insurance options, and providing adequate support to employees. 7. Quality assurance. The quality of Scoro's health insurance is reflected in the comprehensiveness of the coverage, the accessibility of healthcare providers, the efficiency of claims processing, and the overall satisfaction of employees. Regular evaluation and feedback mechanisms can help Scoro ensure the health insurance plan meets a high standard of quality. 8. Continuous improvement. Just like any project, Scoro's health insurance should be subject to continuous improvement. This involves monitoring employee feedback, staying updated on best practices in employee benefits, and making adjustments to the plan as needed to ensure it remains competitive and meets the evolving needs of the workforce. Potential components of Scoro's health insurance, based on general practices and available information. While specific details are unavailable without direct information from Scoro, a typical health insurance plan offered by a company like Scoro might include medical coverage. This would likely cover a range of services, including doctor visits, general practitioners and specialists, hospital stays, emergency care, prescription drugs, and potentially mental health services. Different plan options. Scoro might offer different tiers of coverage, allowing employees to choose a plan that best suits their individual or family needs and budget. These options could vary in terms of premiums, deductibles, and copays. Preventive care. Encouraging preventive care is often a focus, with coverage for annual checkups, vaccinations, and screenings. This aligns with a proactive approach to employee well-being. Mental health support. Increasingly, companies recognize the importance of mental health. Scoro's plan might include coverage for therapy, counseling, or other mental health services. Notably, Scoro has publicly stated its commitment to employee mental health, indicating they provide or partially cover mental health services. Prescription drug coverage. This is a standard component, outlining how employees can access and pay for prescribed medications. Network of providers. The insurance plan would likely have a network of participating doctors, hospitals, and other healthcare providers. Using in-network providers typically results in lower out-of-pocket costs. 1 for employees. 1. Exoticarstorant.com. Exoticarstorant.com. Employee assistance programs. EAPs. Some companies offer EAPs, which provide confidential support and resources for a range of personal and work-related issues, including health and well-being. Additional benefits. Depending on the plan, there might be additional benefits such as dental and vision insurance, life insurance, or disability coverage, potentially offered as part of a comprehensive benefits package or as optional add-ons. Scoro's mention of healthcare and dental plans suggests these might be included.